Hello, everyone, and welcome to Health Law Talk presented by Shahardi Sherman Williams. Before we get started, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube, linked in the description below. We hope you enjoy this episode.
And good morning, everyone. Welcome to another edition of Health Law Talk with Shahardi Sherman Williams, and in the studio, Conrad Meyer.
Good morning, everyone. This is Rory Bellino.
And today we are very timely topic, very interesting topic. We are in our part 3, Rory, of our COVID mental health podcast series. And this time we're talking about older adults.
Yes. Yeah. We've, like Conrad mentioned, we've done adolescents, we've done the adult population, and now we're handling the older population. So very timely. This is going to wrap up our series on COVID and mental health, and we hope you've enjoyed it. Absolutely.
And today we have another special guest, one of our resident experts here on the older population. Gina Rossi is a licensed clinical social worker. She's on the panel with us today. Gina, how you doing?
Good morning, you guys. Thank you for inviting me.
Thank you for joining.
We really appreciate your time. Gina, give our listeners a little background about you and what you do so that they can understand your level of experience.
Okay, well, let's see. I'm a clinical social worker with over 35 years here in Louisiana, and I'll tell you, I never expected my career to move this way and working with older adults. I started off working in psychiatric field, and I became a manager, and soon I opened up a geropsych unit, and that was where I first started working with older adults. I also worked in home health, and I started to become very interested in this, and it became my specialty. But, one of the things I tell people is that, to be honest, one of the reasons that this particular field attracted me was my own fear of aging and what would happen when I was older. Because I became acutely aware of the really lack of resources to persons who were older and alone. And I thought, well, maybe if I start heading and pushing my energies that way, I can learn about it. I can learn about resources. I can maybe even contribute to building resources. So that it was, that is kind of that was why I did it. It was almost for myself. So I'm very invested in this. I became I became a social worker, a gerontological social worker when I started studying more about older adults. I retired from the Office of Aging and Adult Services, where we looked at giving services to people who had very little resources and helping them. Our focus was on helping them stay at home. Home and community-based services is what we call it. And then I opened up a private practice, and I started seeing people in a private practice, and I started teaching adjunct at Louisiana State University, teaching young interns and social workers about this population. And throughout the time, I've always been very involved in the Alzheimer's community here in Baton Rouge. Very, very involved in Alzheimer's services, Alzheimer's Association. And presently, I just started working with Hilarity for Charity. And that's a Seth Rogen organization, nonprofit, as a family support facilitator. So, I spend a lot of time in this.
Well, it sounds like it. I mean, it sounds like you have a vast amount of experience. I mean, it sounds like you're pretty much qualified to me.
Yeah, very, very impressive background. And thank you again for joining us. So, Conrad and I are just going to jump right in. And if you listen to this series before, you'll kind of see a pattern that we like to take. But, the focus of this series is COVID and mental health, and what we've seen work, or a big issue, is that there's been a shift in the mental health practice from pre-COVID to during COVID, and now hopefully we're coming out of this COVID period, but some things that are sticking around and some things that are not. So I'd like to just jump right back in, and if you could tell us a little bit about your practice. And by practice, I mean, were you in person, or did you have any virtual patients? Tell us about your practice pre-COVID, your practice population, kind of how a visit looked, and then we're going to phase right into what was going on when COVID hit, per se, and that time period.
Well, pre-COVID, I had retired and decided I was going to start doing private practice again. I had done it previously, but I was going to be able to dedicate more time to it. And I enjoyed the thought of, getting up, going to the office and meeting with my office mates and seeing people come into the office and seeing them sitting in front of me, seeing their movements, seeing if they were fidgety, seeing, really having a good observation of how they were presenting.
Sure.
And with family members as well. So it was a lot easier when I had an office, and I still have an office. But then COVID hit, and boy, I will tell you, I was one of those that I did not have high-tech skills. I didn't even have low-tech skills. I don't even know why I say high-tech. I didn't have tech skills, period. So I had to learn pretty quickly, how to pull this together. I tried different platforms, and then presently I found the Zoom platform, the HIPAA compliant Zoom platform, because at first it was an emergency. Everybody just started seeing people because people were in crisis, and there were even people seeing people on FaceTime. I didn't do that. I would try different platforms, and when I had to tell the people who I'd been seeing face to face that we were going to be doing this way, there was a lot of reluctance. I'm going to tell you, people were anxious about it because they were low tech too. They did not have a background. A lot of older adults, of course, are not what we call digital natives, right?
Sure.
So they had to learn it. And so I would spend time with them on the phone, telling them how to get on to the Zoom, emailing them and saying, do this. And eventually I kind of developed a little cheat sheet that I was able to send them.
Oh, that's great.
So Gina, let me just ask you this real quick. So there wasn't some sort of resource that you as a provider could go to and say, here's how you do telehealth. Here's what you need. Here's the cameras. Here's the software.
No.
So y'all did this really on the fly.
Maybe there was, but I wasn't aware of it.
Okay.
Later things have been developed.
Sure.
Now providers are doing much better. I did have clients that dropped off that they just did not want to do it. And I couldn't, I wasn't going to go into the office. I couldn't risk it.
Sure.
So I would talk to by telephone, and I tried to find them somebody who was seeing people in the office.
And Gina, what do you think the biggest issue was for your patient population? Right when COVID hit, was it the technology portion where they, didn't have the physical devices to communicate and talk with you? Or was it the reluctance of, older population, they're used to going to in-person visits? Was it that? Was it more of a mental thing per se?
I think that the clients that I see, they had the financial resources to be able to buy these.
Okay.
But they really did not want to. They were too anxious about trying it out. And I want to tell you, people that came to see me, they were already anxious, right?
Sure.
And that's why they're coming. They're and so then you throw this on top of it. It's really asking a lot. I mean, it's it's almost incredible bravery for somebody who is already dealing with anxiety, dealing with problems, and then to throw this at them.
So, and what I meant for that, Gina, also, like my father can't even turn the TV on. My father is an older, adult, and he has trouble turning the TV on.
Right.
So
Conrad,
did you
I'm going to tell you. I'm going to tell you, Conrad, by some luck, my parents who live in Houston were here the December. We got the notice in March. In December, I decided they were still playing around with a flip phone, and I said, "This is it." So got them an iPhone, and thank God I spent the time. Now the guy at AT&T, I can't even look him in the eye anymore. He doesn't want to see me coming. No. I got them 2 iPhones, and I taught them how to do FaceTime, text, and now Zoom. And my dad is 88. My mom is 90.
Wow.
So it's not like, so be very careful, because a lot of people, they put older adults in this homogeneous box, and it's a wide spectrum of functioning.
Sure.
Well, let me ask you this. So based on what you just told us, did you find that older adults responded in kind and said, hey, we're jumping right into this and adapted to the technology and we're able to do telemedicine with you?
when somebody spent the time to help them through it.
Okay.
Got it. Okay.
I got to tell you, it's been a little disappointing when I hear about some of the assisted living facilities or nursing homes that maybe a family member brought an iPad and they just left it there because they weren't able to stay. And no one spent the time to say, Mrs. Bro, this is how you use that. You press this button, and I'm going to write the instructions down right here. And like number one, which is what I did for my dad. Number one, I emailed it to him. Remember, number one, it looks like this. This is the screenshot. This
so
is
you're telling me, let me ask you this. So you found in assisted living or nursing homes that there was a lack of equipment for the residents to reach out to family members. And then secondly, the staff wasn't working with the residents to reach out to family. Is that fair to say?
Either they had the lack of knowledge or they just didn't spend the time.
Right.
Well, and to be fair, this was at the very beginning.
Okay.
They were very stressed for staff. And at first, not everybody had had the equipment. And I don't know, maybe the staff didn't know how to do it. Maybe the staff didn't feel competent to be able to teach it. But when you look at it, when you look at the options, it would not be hard to bring in a college kid or really even a fourth grader to say, can you spend some time helping the residents, helping the assisted living residents learn how to do this so they can call their grandson.
So is that still going on, Gina? Or let me ask you, I'm sorry to interrupt. Is that still going on, or do you think it's better now?
I think it's better now, but it went on a long time. And these are nice facilities that I'm aware of. So that was very disappointing. These were not, facilities out there where they didn't have those kind of resources. And it doesn't take much to be able to improve somebody's life.
And I can tell you, I mean, I'm just from a personal standpoint, or just from people, Rory, that if you're not able to reach out you're already isolated in an assisted living or nursing home already. Right. And I mean, the inability to reach out, or to see a family member or a friend.
Especially when a lot of them closed and weren't allowing even family members to come visit during the peak of this.
Imagine the effect that being able to do not even telemedicine. I mean, just to FaceTime a friend.
Contact.
Right. I mean, Gina, do you think that would have made a big difference in the mental health at the time?
Absolutely. Now, it's not the same. People say, oh, well, no, it's not the same as a hug. Well, it's not the same as a hug. It's not the same as seeing your grandchild, and kissing them. But it's a connection. I talked to people who said, my mother has literally been in a room for a year.
Sure. So for your patients that were able to get up to speed and that were able to get the assistance, whether it was from, someone at their facility, if they were lucky enough, or a family member, tell us about how some of those visits, those televisits went. And, did you find that they were an effective therapy session? Did you, what were kind of the pros and cons? What did you like about them? What didn't you like about doing a televisit with an older population?
So I'm still doing telehealth.
Okay.
I feel like I'm getting better at it.
Great.
It does take it's a different skill. It's a different type of attention. But when I ask a lot of my clients now, some of the ones that were driving, for example, they're okay with staying there at telehealth because they don't want to deal with the Baton Rouge traffic.
Sure.
But some are saying, can we please meet in the office? And so for very few, I meet in the office because I'm still very cautious about COVID myself and bringing it to my loved ones.
Sure.
And it's at least in telehealth, you don't have to wear a mask. In the office, I do use a mask. And so you really can't see the facial expressions anyway. You can see the rest of their body, if they're fidgety, if they're anxious, how they're dressed, if they're, how they're grooming, things like that.
And we've heard that from a lot of our guests is that there's something about having that person sitting across, on the sofa directly across from you or a table. You just pick up on more cues to really find out how their life is going, what their issues are.
Yeah, and it's easier to have a family session because now I do family sessions online. Some people prefer to say, well, I'm going to be on the computer in my room. My mom will stay right here. And so they'll be like having a family session with little boxes. And sometimes they'll be sitting right there next to their loved one. And that's a little awkward because they're like really tight right next to each other, and it doesn't make for a very comfortable setting. So sometimes they'll separate and be able to share, in their different areas.
So, Gina, let me ask you this question in terms of telemedicine now. Definitely, in your opinion, is telemedicine now and going forward going to be an integral part of your practice, or is it just a tool right now because of the COVID restrictions and so forth?
I would say that it is going to be an integral part of my practice. So, people use the term hybrid. Sometimes in the office, ideally what I would like is to see somebody in the office, see them, really get to know them. And then when I see them on a telehealth visit, then I already have an idea. I can sense about them. I've already seen them at least once.
Okay.
I think that's really the ideal. Not everybody is a good telehealth client, though. Some people you are going to have to see in the office, especially, I have seen people in crisis on telehealth. But it's better to see them in the office. Now, I've had clients who when we first started off, were just couldn't deal with it, and they were going back and forth, and they couldn't figure it out, and then they just went off. They clicked off. And that happened with some of my clients, also with their psychiatrists, because they've had to learn different platforms, right? I use this. Somebody else might use a different platform. And it's a lot for people who are already dealing with anxiety and having trouble focusing.
And that's hard when someone, like when you're on Zoom or they're on Skype and someone's using FaceTime and that one person's your go-to meeting. I mean, we don't get any, just so you know, we don't get any sponsorship from them.
Right.
But when you're using these platforms, it's hard if you're not using that, then how do you sync and how do you get to these people?
And jumping around.
Yeah, it takes a lot of prep with them. I tell them, now here's the guide we're going to use. When I meet with you, you have to be someplace that you feel very comfortable, that's very confidential, that no one's going to interrupt you. And I tell people this, and I say, I want you to be as if we are in my office, seeing each other face to face. And sometimes I got to tell you, people are in their bed, laying down, and I say, I'm making up a name, Tom. I really feel like I have your attention if you sit up.
Sure.
And so he'll sit up. And then sometimes I'll see somebody's family member walk by in the background. And I'll say, Tom, it's really important that you and I speak confidentially.
Right.
I need you to go to a room that's really private, please.
And Conrad and I both went through that for just during the pandemic, trying to work from home, and we're on calls or doing work or a ton of times when I was on calls that you'd hear kids in the background or the microwave going off, or it's hard to get that dedicated concentration. I would think in therapy sessions you really need that focus, and I could just imagine the issues that were faced during this.
And sometimes if it's an older adult that doesn't have the experience with Zoom, their loved one, a caregiver, will come in, set them up, and I'll see them and I'll see their caregiver, and then ask the caregiver, thank you. If you don't mind, now we'll have some private time with, Tom, as I'm making up his name. So that's okay, because they'll set them up and then they'll leave.
That's great. So from a standpoint, I want to talk more about the issues that you face, but from a device or a technology, physical standpoint, what's the biggest barrier that you saw? I know you mentioned in the beginning that most of your patient population had the financial resources to, get the devices that were needed for these televisits, but was it just the educational part of teaching them how to use it, or was it that there was a hesitancy for them? Like what kind of physical barriers do you think that you faced, getting people set up?
Well, it's different for everybody. I mean, there's not one answer. For some people, it was a hesitancy. I don't want to do this. And some people feel like this is, they were really rigid about how they were going to go into therapy. And remember, for older adults, therapy is basically a new mode for them anyway. A lot of them are reluctant to go into therapy because they see it as very negative. They see it as a weakness. It embarrasses them. So just to get them to therapy is important. And then now we're asking them to do it a new high-tech way for them. That's double. Now for some people, it is the education. And once they get a hang of it, they press this button. If we give them the tip sheet, they feel stronger about it. And it actually, the accomplishment adds to their sense of self-esteem, and that that they're learning and they're keeping up. They feel better about themselves too.
Now, I know we've talked a lot about the barriers, but I'd love to hear from your perspective with your older population. What are some of the things that you've loved during this period? What are some things that your patients have loved, whether it being they don't need a caregiver to drive them through, like you mentioned, the Baton Rouge traffic, or, sit in your office, wait, get checked in? Like, what are some of the good things? What are some things that you've really loved with this switch over to a telemedicine practice?
Well, I do like that it feels like we're all learning together. And I tell them up front, and I say, you know what, Hank, I'm learning this too, and I'm not perfect at this, but we will work through this together. And for us, that creates a bond between him and me.
Sure.
We're figuring this out together. And so it's a sense of teamwork with that.
And what are some of the things that your patients have liked about have they mentioned things that, I really like doing a televisit because XYZ?
Mainly the reason has been traffic. I got to tell you, having to get out in the traffic saves them so much time.
Sure. And I would assume that does it save you time as well? Has it
yeah.
allowed you to be more efficient, see more patients, kind of book them closer so you have less of a documentation time? I mean, tell us from a practice perspective, name some things that you've really liked from switching over to a telehealth model.
For me personally, it has been not having to deal with the traffic as well. But I'm in several groups where people specialize in different areas. There's a group about telehealth, and I'm very careful to make sure that it's not about my needs, because I've seen that happen too. And people put people in a telehealth, their clients in a telehealth that really aren't. They need more. They need more than telehealth. They absolutely need. And if that's going to be somebody that I'm seeing and I'm not seeing them in telehealth, I'm going to have to refer them out, because it's not for me. It's for them. If just because I'm happier here and my cat gets to sit on my lap, no. Some people, if they're in crisis and they need eyes on somebody, I usually refer them to somebody that needs that.
So Gina, I want to pivot just a minute here. We've gone in detail about telehealth and how it changed in terms of COVID and how it's really affected the older population in terms of, and you in your practice. But tell me this, let's talk in general. What has COVID done to the older population in terms of mandates, social distancing, can't see your family? Now, you got to get the vaccines, got to get boosters. What have you seen in your practice with the older population? What has this done to them?
They are weary. They are weary. Aren't we all weary? But think about it. A lot of older adults who may not drive and are dependent on other people to get them out have tended to become isolated. And one thing I like to tell people is that we generalize that older adults are isolated, or they choose to be. But honestly, we isolate them, or we isolate ourselves from them. So that's a problem, is that they have become more isolated. And we know that human beings need other people around them. It is good for our health. Mm-hmm. I mean, this is now evidence-based. This is now science that shows us this. And so there was just a study done recently, about 2,000 respondents. And these were people from like 50 to 80 years old. And they said, so most people, their mental health was not really worse. But guess what? For 28.3%, they had worse anxiety, and 19% had worse depression and less sleep. So maybe the majority are not, but 28% is a lot.
And Conrad brought up the mask and the vaccine, and I definitely want to jump back to that. But, this just came to my mind because of your older population, and I think you mentioned this with the facilities or the nursing homes. So, and I'm sure this was across the country, but our focus in Louisiana, how did the nursing home lockdown or shutdown per se, what effects do you think that had on that population, where literally the only people going in and out of those doors were staff. Family had to, we've all seen the pictures of the family members standing out, on the balcony looking down, or, the patients are looking
outside
down,
in the grass,
outside of the window, or they're in little bubble tents. What effect do you think that had on the mental health of They could all have, even if they had the FaceTime or they had the phone calls or they were standing on the other side of a glass, what effect did that have on the mental health of the older population?
Well, that isolation really hit a lot of people in terms of making them more disoriented. Because if you're in a room and you lose track of time, the shifts change and Susie here is 3 to 11 shift, but you start to lose track of time. And actually, I was at LSU School of Social Work and we were contacted by one of the retirement communities, and they reached out. They said, we are noticing a significant difference with our residents. Their dementia symptoms have increased. And not just that, our staff are struggling too.
Sure.
So my class, they went right to work at looking at different options, and a lot of the options were related to technology, getting iPads, figuring out ways to, increase communication, or finding groups that would reach out to people who were in retirement homes or nursing homes, helping them connect with the outside. It might be, maybe there was a school group that recognized, what can we do as a service? Let's get some service hours and let's reach out to older adults in a facility and help them connect.
Sure. Now, we talked about this in our previous episode with the adolescents, but I want to talk about masks for a few minutes. Have you seen any issues with the older population and the mask mandate when it was in effect, and then when it went away and now it's back again, at least in Louisiana? When we had our guests on for adolescents today, that was a big issue that they said that kids really struggle with the masks, and it's hard for them to pick up on social cues from their teachers or their parents and see facial expressions. That was really hard. Have you seen that with the older population?
I certainly do see them struggle with having a mask, but I guess the difference might be that a lot of the older adults feel are more concerned about the COVID and the Delta variant, so they're less likely to take it off and say, I don't need this. They want them on. The ones that I work with want them on, and they want others to be masked as well. It makes them anxious because, think about it, this strange, mysterious disease comes, and who is the population that it starts to wipe out, really, is, they're thinking, it's me. This illness is wiping me out.
Right. When this started, the statistics were that it was affecting the older population the hardest.
The worst. And already some of the older adults that were feeling depressed, anxious about aging. And here comes this next message. Well, now the whole world is saying that it's older people. And then the saddest part to me, you guys, I'm going to tell you what made the angriest, because, one of my next, things that I work on a lot is on ageism, and almost a disrespect for what this was causing older adults. And the whole thing about, well, it's just the older adults, or it's just people in nursing homes,
Right.
as if it's just as if that didn't count.
Like there's some sort of like stale milk.
Yeah.
Right? Like we just throw them out.
That's a good point to bring up, because I remember when this all started, the statistics were it was affecting the older population seemed the most. And you heard a lot of people say, well, just keep them in their nursing homes or their facilities and they'll stay in there. We should, continue to keep the economy alive and go to work and go to the office, and let's just keep them locked up until this thing fizzles out. And I'm sure that had a terrible, that came across as a terrible message.
I just think overall, I mean, and I'm sorry to inject on this, but I think that just overall, I find that there's just a lot of lack of respect for the older population. And I mean, one is the most heavily regulated section in the healthcare market,
right?
And you know that. So, but still, I mean, just the lack of like decency and respect. Just strikes me in this. And
that's been going on for so long, and this has just made it worse. I mean, I've shown this to some of the students I work with, is, here are some signs of ageism. And since COVID, let me show you some memes that have come out that are so hateful about older adults, especially around COVID.
Sure.
Boomer, like the saying boomer remover.
I haven't heard that one, but
yep.
I don't know what that means, but I understand it's terrible. But Gina, let me ask you this: on the same front, vaccine mandates. Okay, we've heard different responses across the board, and I'm curious to see what you've seen in the older population. More receptive, less receptive, mixed bag. What's been your what's your take on that with the mandate?
I would have to say mixed bag, and I'm going to tell you the truth. I don't ask them. I try to avoid asking about those kind of topics that are political, that can be polarizing between me and them, because I want us to focus on their issue. Because once we start going down that way of, politics, the next session they want to talk about this, and I'm trying to stay away. Personally, of course, I have my own personal feelings about mandates. I'm a very safe person. I don't have a sense of safety unless people are vaccinated. But I would never tell them that. Of course, I probably just did right now on the podcast. That's okay.
That's okay. Well, I guess the thing is it really that political with your patients now? I mean, do they see this as a political issue and not a health issue? What are the older patients? What are the older populations saying to you about that?
I think that they're the ones I'm seeing right now. I'm going to tell you, a lot of them are. They're very delicate about it when they talk to me, and actually it makes me wonder if maybe they don't want to offend me either. They don't want to offend me. They know that I'm very careful, but they recognize that we have not talked about mandates,
right?
Okay. About that.
Now, and another thing too. So everyone is being affected by this. This is not. I mean, we've seen across the board from kids, adolescents,
right,
families, elderly, older population. Has been affected by the pandemic. Now, do you think that some of the lack of communication or the lack of reaching out is simply because everyone is so stressed and, there's not enough capacity for some of the families and young adults to reach out to the older population? Are you seeing that as well?
I am seeing that. And, one thing I want to make sure that I talk about today is when we talk about a lot of time when we talk about older adults, we're also talking about their family and their family caregivers. Because, I'll never forget when this first started, I was highly anxious thinking about, supplies, how we all got about supplies and everything. And I talked to a lady who was a caregiver, and I thought, oh, my God. I said, how might this be for you? Because you're worried about you and your family, and you also have to go to your mom's house and be concerned that she also has supplies. So it's when you work with older adults, you are also constantly thinking, there is another client here too. And that's the family caregiver that's worried about mom or their husband or, their loved one. So it's that whole population that grows, who this affects really grows exponentially. It's not just the person that we're talking to. A lot of times there's a support system. Hopefully there's a support system that we're trying to help as well.
Sure. Now let's I also want to get your opinion on how things are going now as far as, we're in late September 2021. Where do you see, where's your practice right now as far as, your visits go, breakdown of in-person versus virtual? And then, kind of where do you see things going for your practice? What would you like to keep? What would you like to change? And for your patients as well?
Well, I got to tell you, when the vaccines came out, I had such high hopes. Many of us did. We thought, this is great. This is what we're waiting for. We're getting back to normal life. And I saw myself getting back to the office. And I went back to the office, saw some people, and we would look at each other. And I said, I am vaccinated. They said, I'm vaccinated too. So we took off our masks. That was very short-lived. Okay. Because soon afterwards, we started learning that it wasn't everything we thought it was going to be, and there were breakthroughs. So I've gone back to telehealth. Of course, hoping now maybe the booster, maybe that'll send us back into living a little bit more normalized, whatever that is. So I'm hoping to go back on a more regular basis.
What about your patients? What are you seeing with them? Do they want to come back to in person, or are a lot of them saying, "Hey, this virtual is working fine. Let's stick with this"?
Yeah, let's keep it.
A lot of the virtuals do want to stick with it. They want to stay
Interesting.
virtual. The new people that are calling, when I tell them that I am still virtual, I can kind of hear, I can hear some disappointment.
Okay.
So I say, really, I can't guarantee you when I'll be seeing somebody in the office. So, I'd be happy to refer you to somebody who is seeing people in the office.
Sure. Now, from it sounds like you're set up technology wise now, and you talked about how your patients are as well. Let's talk about kind of the big bad wolf in the room of reimbursement and insurance, because I know that was brought up on our other two series, issues that their practices have had with billing for this, with figuring out how to bill for it. Some payers pay for it, some don't. Tell us a little bit how that's been on your practice in your office from an insurance standpoint.
Well, I got to tell you, I'm kind of I'm a small population. I do it very, very differently. I'm only taking private pay.
Okay.
I am not on the computer trying to figure out claims because I'm a very small operation. So, other people would be able to give you a better idea. And people, they send a check. They send a check or they drop a check off and I'll pick it up later. I've had very little problems with people not paying me.
Well,
and I tell them, know what? I trust you're going to pay me.
Gina, let me ask you this. Well, so have you gotten to using Venmo, PayPal, Cash App, anything like that? Do you do that for your patients, or is always
I had started that, but there are some HIPAA problems with that now. So Venmo and those things are no longer appropriate for HIPAA reasons.
And is that because it's showing on the portal that so-and-so paid you?
I don't know why. That's just what I'm understanding from my professional colleagues. But when I did, it was secret. Nobody could see it, of course.
Sure,
some people have all their friends do that. No, I never did that.
Okay.
But I'm going to Ivy Pay, which is a HIPAA.
Okay.
HIPAA approved. I have an Ivy Pay account.
Okay, great. Gotcha. Okay,
great.
That's good. Well, so since being private pay, you don't have to worry about reimbursement or insurance or anything like that.
Yeah, I'm fortunate in that way.
So let me ask you this. So let's pivot to resources and go from there. So, what do you tell the older adults, or even their family members or friends? What can they do to get resources to help, right? For the times that you can't be there for therapy, what are some resources available for family members and friends, and even the older, to help the older population, and even for the older adults themselves?
Well, depending on where they are in their functioning, it might be somebody who has depression, or it might be somebody who has dementia. Luckily, we do have a lot more telephone resources that have come out. And for example, there's the SAMHSA National Helpline, and that's a 24-hour line. Let me give you that number while I'm right here. I've got a list in front of me.
Absolutely.
So that national helpline is 1-800-662-HELP. So that's 1-800-662-4357.
And what does that do? What is that helpline for? Is that for anyone that needs to talk to someone?
Anybody can talk to somebody 24 hours a day, and it's English and Spanish for family members, for people who have mental or substance abuse. And there's another one, because, let's recognize that things can escalate quickly for some people, and they're thinking that they're feeling hopeless. And there's a National Suicide Prevention Lifeline as well. I'm going to give you that number. This is the National Suicide Prevention Lifeline. It's 1-800-273-TALK.
Great. Good.
That's easy to remember.
That's good. Now, let me ask you this. Good resources for reaching out. Is there anything that that either families or friends can look up on the internet that would, or resources or call that would help them reach out to nursing home residents or their other friends and family? Is there anything available for them?
Well, if let's see. So if there's there can be many issues. They could be wanting to talk about their own stress or their own concern about their loved one, and maybe they have a loved one who has dementia. And there are, thankfully, we have more and more, Alzheimer's helplines. And I'm going to give you one right here. The Alzheimer's Association helpline is 1-800-272-3900. and there are many phone numbers. And basically, if somebody has a computer, they can Google helpline, crisis line, but these are ones that I give out on a regular basis. And I also encourage, if I'm seeing somebody, a lot of times if they're, once we're set and they're doing better, I also I like to supplement their treatment with a support group. And I will try to put them in touch with a support group wherever they are in town, because there's nothing like being able to talk to other people who are in the same position as you.
Sure.
I have lots of information, guidance, whatever, but it's not like, this other lady who is experiencing the same thing as you.
So, Gina, this has been an amazing podcast. I really appreciate your time and insight on everything. Kind of a final thought from you. What changes do you hope to see from the mental health in the older population? Where do you see things going? What would you like to see, or what are you continuing to work on? Like, kind of what's your mission at this point?
My mission is to really give mental health for older adults a lot more attention. If we don't do it now, when we've had this huge COVID, examination and study about how this has affected older adults and what isolation has done to increase their depression, if we don't do this now, I don't know how we can go forward. But my thing is to recognize that we have tended to, because we are basically in an ageist society, we have tended to put them someplace. And when that happens, we alienate ourselves from them, and instead of bringing them back into our world, our community. And I'm hoping that is a major change that comes about from all of this.
Fantastic. Well, Gina, we want to really thank you for coming on today's show. It's been very pleasant to have you here.
Very informative. Thank you so much.
Extremely informative. So we want to thank you for that. And for all of the listeners here, we want to just let you know, please, if you like this podcast, please hit subscribe.
Share with your friends.
Share, retweet, and subscribe to the podcast so you get announcements when things come out. If you have any questions, comments, or anything you want to see on, please feel free to email me at cm@shahardy.com. And Rory?
rbelina@shahardy.com, it's all linked in our bio as well.
Great. Good deal. So thank you so much, Gina. Sit tight.
Thank you.
And we really appreciate you coming on the show today.
I appreciate you all listening to me.
Thank you for listening to Health Law Talk presented by Shahardy Sherman Williams. For more information or to contact us, please visit our website linked in the description below. Also, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube, linked in the description below. Thank you for listening.